Hi, everyone, and welcome back to our discussion of schizophrenia. I wanted to wrap up today by just chatting a little bit about the medication that people use to manage their psychotic symptoms, their positive symptoms of schizophrenia, and just a little bit of information about how doctors in the healthcare system often will manage or support patients with schizophrenia to manage their symptoms. So the medication most often prescribed for schizophrenia are antipsychotics. So there's two different generations of them. There's the first generation, which is the older antipsychotics. They don't use them as much anymore because of the side effects that they have. And then there's the second generation, which are the newer ones, including what's considered one of the most effective treatments for schizophrenia, which is clozapine. It's one of the newest medications out there. It brings with it its own challenges, but it's one of the most effective if someone's symptoms are a little bit treatment resistant. So that's an option as well. One of the biggest challenges people with schizophrenia face, or any type of psychosis face, is that the medications that are used to treat these symptoms can have some pretty nasty side effects. And so if you think that you have a belief about the world and you're pretty sure everybody's lying to you, but if you take this medication that really makes you drowsy and you feel kind of lousy and, it's making you gain weight and all of this stuff, then you think the way everybody else wants you to think. But when you stop, all of a sudden it feels like you realize everybody's been manipulating you. So why would you continue to take the medication if it feels like people are using it to control you, basically, especially with the not great side effects? And so often people will come off their medication and will end up becoming unwell again, and often brought into hospital by a friend or family member because they start perhaps acting in ways that are unsafe to themselves or unsafe to others. And so then they end up back to their psychiatrist and possibly provided with a different prescription, or their new prescription is started again, and they get back into being compliant with the medication. Now, recently here in the Edmonton area, there was an individual that it was all over the news that ended up being diagnosed with schizophrenia after doing something quite unsafe in the area. And people were quite upset because he had been released from the hospital that he was staying in. And so the reason that was possible is that our medical system has the option for psychiatrists to allow a patient back into the community with what's called a community treatment order. So what they do is they set up that it's required for the person to come in and get an injection of their antipsychotic medication from a nurse that's familiar with the order. And then if they miss the dose for whatever reason, then the healthcare system and sometimes the justice system can be activated to bring that person directly into hospital. And so they're constantly being monitored, and they know exactly how much medication this person has taken. They know how many doses, and they're on top of making sure that these individuals are healthy. And I mean, when we're talking about a definition of harm to self or others, again, like I said at the beginning of this series, it's very rare for individuals with schizophrenia to do harm to others. A lot of times it's harm to self. In the rare cases like the one that happened in somewhere in Alberta, it was quite a few years ago now, that was a rarity, kind of a 1 in a million event that happened to occur. But regardless of how the illness manifests, if there's any kind of risk whatsoever for anything, then our medical system has put things in place to help make sure that everybody stays safe and that the person with the diagnosis has a chance to actually live their life well medicated, so that, they can participate in society and they're not, healthy or thinking clearly while on their medication, but still stuck, never being able to leave. So that's a little bit on the medication. I'm not going to get too far into it because, of course, I'm not somebody who does prescribing for that medication. If you have serious or major questions about medication in schizophrenia, a consultation with your pharmacist or with a doctor would be an excellent place to start. This is just some FYI information for people who might want to wonder or might want to know a little bit about, what do they treat people with schizophrenia with, and how do they make sure that they're compliant with their medication. So that wraps up our schizophrenia topic. I think in the next video, I'm going to start addressing hoarding disorder, because that's something that has been showing up a little bit more on our radar recently. But other than that, thank you for watching.